Okay, guys, I'm getting back to you because I don't know how to do TikTok.
Hi, dermatologist here. I posted a reaction video to that video last week, and a lot of people brought up delusions of parasitosis in the comments, so I figured I should talk about it. Disclaimer, I didn't even know who Brandy Glanville was before I saw that video, so I'm not talking about her. I have not treated her. I'm just talking about delusions of parasitosis since y'all brought it up. Why? Because I think it's fascinating and it's one of the conditions that really highlights how dermatology sits kind of at the intersection of, overall health, mental health, internal medicine, like everything. So, at its core, delusions of parasitosis is exactly what it sounds like. It's when people have this fixed belief that there is some sort of parasitic organism, insect, microorganism, etc., that is like infesting their skin. They do present with a rash, usually because they're scratching and picking at their skin repeatedly, with classic findings of angulated and like linear lesions. So these are from scratching and picking, and that type of presentation typically we would say is an outside job in dermatology because it's like what people are doing with their hands, nails, or like instruments. I've seen patients using like utensils, etc. Another classic finding is that the areas where the patient can't reach are spared. So usually like there in the center of the back. You can see it here too. Like the lesions will be just limited to areas where the patient can actually reach. There's kind of an offshoot of this condition that is referred to as Morgellons disease. This is a condition where patients believe that small filaments are like coming out of their skin instead of parasites. Interestingly, there is like a large community of people and support groups for that condition that think like that there is a real physical finding and disease process going on. However, like there has never been an investigation to really support that, and they often present like people with delusions of parasitosis. The term Morgellons disease was actually coined by the community of people that suffer with it. Now, the reason that I say that this sits at, the intersection of mental health and physical health is that this can be brought on by mental health conditions, such as, schizophrenia, other psychotic disorders, or it could be the cause of depression and anxiety. And this could be set off by other medical conditions that actually cause people itch, like neuropathy, like liver disease, kidney disease, etc. So there may actually be a physical symptom going on that is not parasitosis, but people can develop that fixed uh, erroneous belief that they have parasites living in their skin. One interesting thing about the presentation of this disease is that people will often come to you with like a collection of fuzz or flakes of skin or anything that they've picked off of their body for you to like examine, which could be kind of gross, but I'll talk about that again. The general approach to treating this is like actually work the person up. Like that could be as far as doing a skin biopsy. It could be like actually like putting whatever they bring you as far as skin scrapings or fuzz or anything else under the microscope and actually looking at it and examining it. In addition to that, like doing a workup for reasons why these people may be itchy or experiencing formication. Formication is like a feeling of like you have ants crawling on your skin. There are neurological reasons why that could be happening. It could also happen from substance use disorders or withdrawal. You do want to take the patient's concerns seriously. What you don't want to do is to um, basically play along. So, like to say to them, oh, I'm going to give you an anti-parasitic cream and this should take care of it when you know there are no parasites there. You want to constantly remind them that there are no parasites. However, you want to build trust with them, so they might need frequent visits And like anytime that they want you to investigate something, if it's within reason, you should do it. My approach has been whenever, I encounter somebody with this to tell them, like, the feelings that you're having are real. Your physical symptoms are real. I do not doubt that. But it does not seem to be a parasite or any sort of insect or anything like that. Like, take them seriously because these people may actually be experiencing physical symptoms that have just, caused them to have these delusions. I've also, like, kind of insisted that patients consider therapy as a possible adjunctive treatment. And some of the classic therapies for this are actually antipsychotic medications, especially if there's no identifiable cause for their physical symptoms, which, you would get psychiatry involved to help you with that. Any other interesting skin conditions you would like to know about? Let me know in the comments.